Hi Maya, how are you doing?
Hi Jaishree, great. How about you?
Very, very good. So, you've been in the industry, you've been one of my mentors, and you've been here for a very long time in the field of aesthetic dermatology. How did you enter this fillers and botulinum toxin field?
You know, I always wanted to have a niche practice. And then to have a niche practice, you have to stay on track. So I was just wondering what was the latest things that were not in our country, and I thought that would be the best thing to do. So I adopted this scarcity technique, meaning there is a need and no supply. So I found that these two procedures were the topmost that was needed for our patients. So I actually went out to learn them, and once I came
because
back,
in those days, and in fact even today, it's not introduced, it's not there in the curriculum, but yes, we have a lot of workshops and stuff. But back in the day when you started, I mean, Botox and fillers were like completely, where did you learn and how much time did you take to actually get the confidence? How did you convince your patients?
See, actually I went to Cleveland Clinic because that was a place that offered me an observership, and I made sure that I visit all these departments which were not there in our country. So they had a Botox department, and they also had a filler department. So when I went and I actually thought it was a most difficult thing to do, and I thought it was dangerous to do. But then it was like a child's play when I saw them doing things. So as soon as I came back, I was wondering how to source these products. Then I found somebody who was visiting our hospital from the United Kingdom. So he was a plastic surgeon and who was aware of this product. So I asked him if he could bring it with him to try it on few of my patients. So I was actually doing small numbers to start with. One is because of the trepidation, and the other thing is I wasn't too sure about the acceptance in our patients. And by the time I got familiar with these products, the Allergan was in with the botulinum toxin.
Okay.
So it just tided
so
over my crisis.
you're one of the pioneers of injectables in our country, right?
Yeah,
because you brought it before it even came into the market. So
that's right. I really didn't know that I was getting into injectables. I think unknowingly, by default, I got into injectables.
And that's so good because you have taught us so much, and you've not hidden anything. You've brought about clarity. You've taught us. I mean, I remember always running for your lectures, as a student, and even later on, even till today. So, what is the difference between then and now in terms of patient awareness? I mean, how at that time, like, people didn't know so much?
At that time, patients were a little naive. They would just trust me, and then based on my recommendation, they would take it. And of course, I used to do it only on selected patients. But now I find that patients' awareness has increased. So some of them come with the request, while some of them go on the internet, Google all the negative aspects of it, and they refuse outright. So it's actually a balance between patients who are able to accept it and patients who are refusing it. So now it's actually even harder to convince because they are all over the internet, they are over the magazine, both good, bad, and ugly of the injectables.
True. Because what's happened is, these pillow faces and the duck lips and these kind of things have come about, and people have over-injected, and it's now no longer natural. And people are now coming back to, we want to look natural, and we want to look, and that's probably one of the reasons why it's getting more difficult to convince them, because the moment you say injectables, they run away. We don't want a frozen face, we don't want duck lips, we don't want pillow faces. I face that in my practice every day. Do you face that too?
Of course, they freak out. Some of them really freak out, and when I use the word Botox, they said, oh, I don't want a paralyzed face. When I tell them fillers, no, I don't want a fat face. They all know only the negative aspects, because only the negative aspects are blown up in magazines and in other places, you see.
So how do you convince them?
Jaishree, before me telling me how I convince the patients, now
you have to convince yourself.
Patients than me. So I think that's the current scenario. So now you must tell me how you have been able to convince so many of them to do it. I think that's the truth.
So I I have these modules in the clinic where I have the entire science, laid in either in my laptop or it's there on our iPads, where the anatomy of aging is shown, just like we have our PowerPoints, but in a more simple way. So how the bone changes and how the fat changes and how the muscle changes. So you talk science to them that, this is what is happening, and your foundation is crumbling down. You have to build that foundation, and so you will be able to build that foundation with the help of fillers. And that's how I actually start with science. And then I show them some of my before afters. I do invest in a little bit of free treatments once in a while. I do injectables for free in patients who are willing to have their pictures being shown to others. And so I have not too many. I have maybe one indication each, and then I will show them to those patients. And I'll actually, what happens is, in our chubbier face, if you actually inject the peripheral area and you create that lift, you're actually creating a narrower face. So when you show them that before and after, or you show them a young face who needs tear trough, and you do the tear trough and it looks good, I think the science and the before afters together convince them more. And also tell them about the fact that the face is full of blood vessels. So they can bruise, but not to get worried, because that bruise is going to go eventually in about 5 days or 7 days. So that's my modus operandi.
How do you manage your Botox patients? Because, more than the fillers, the refusal for botulinum toxin is more.
Yes.
Immediately they say, paralyzed face, I want to have my expressions, and I don't want anybody else to know that I've had Botox. So how do you manage that?
So my dosage is very different. I think once we had this discussion, and I literally tell them that it's baby Botox. Because I will do less number of units and keep the expressions intact. For example, in the frown, if I see a prominent frown, I would not go beyond 12 units. I would even sometimes just do 10 units. So the frown is there but not there. So I usually do that when it comes to Botox, unless I'm doing masseters where, in a female, where I do end up doing 30 units also, or sometimes even 40. Sometimes even 15 and 15 are enough. So it depends on how the bulk is. But when it comes to the face, crows, I usually do between 7 and 9 units. I do not go beyond that. My frown is always 10 to 12 units, and my forehead is 5 units, and that's it. And that sort of, and I tell them that, look, your lines are not going to disappear. It's just going to look softer and fresher. And I think that is the key, because that's what they want and that's what we also want. We don't want to, tomorrow if we do something and the patient goes to a party or wherever and they say, who are you going to? And it's our name which ultimately gets spoiled. So,
which means they have to inject more often?
Yes. So when you're doing a lower dose, maybe not really too often, but maybe once in 3.5, 4 months, they still come in.
How do you manage your celebrity clients? I know you are up in numbers in treating a celebrity.
It's the toughest thing to do. Trust me, it's not hunky dory. It only looks really lovely, but there are days when we are like, we've had it now. I don't think I want any more. But we have to have a separate appointment system for them. So we do not have online appointment systems, because you can't have any patient go and schedule an appointment for themselves, because then they can clash with the celebrities. So I work from 8 in the morning to 10 in the morning for celebrities. So actors who want to come in, they come in during that time. It's not every day, but on days that they want to come. And then again between 7 in the evening to about 10 in the evening. And between 10 and 7 is the normal patient's time. So this is how. And then of course, luckily now I have a clinic which has an entrance which goes right behind. So your car can come right behind, and the lift, they get down and the lift is right there. So nobody from the front gate sees who is getting out. And I have 3 doors to my clinic. So one is the common entrance, and 2 are the celebrity entrances. So if I have 2 celebrities at one time, so it's like a semicircle, my clinic. So so there are 2 doors, opposite each other. So we sort of hide them into that room and this room. We pack them. So that's another thing we do. And of course, what is very important is to really discuss things with them and give them a real picture. That's very important because they expect miracles and they expect no bruising. They expect instant results. So the expectations are very high. And so it's very important to sit and counsel them and tell them that no, these things. And they do not allow you to take photographs. So what I do is I tell them, if it's just the eyes or just the lip, I tell them, look, I'm going to click and show you. And I actually show them the photographs and I show them one picture before their photo that so they know I haven't taken their full face. Or I take the photographs with their camera. And I tell them, this you can't delete because this I have to keep as, my reference when I finish injecting you. And never forget to take their consent. And always, if you give in to, can you come to my house and inject or can you do this? If you give in to that, then you're stuck. So that's something I put my foot down and I tell them that, look, except for one person, for everybody else, actually for two people, but for everybody else, it has to be come to the clinic. Now, sometimes they do want to come between a 10 and 7 slot. So you tell them that, okay, appointments are full. We'll put you in from one door because we have 3 doors, but you may have to wait for the main doctor, for Dr. Jaishree to enter, and you may have to have the subordinate doctor see you. So explain to them and they come in. So these kind of things, we do not take any favors from them.
Exactly.
So I never ever in my clinic, none of my staff are allowed to take photographs with the celebrities. There's no wow factor. We teach them no expressions. You can't show them,
Exactly.
And at the same time, I mean, of course, if you're meeting at parties and stuff and we've taken photographs, that's different. But otherwise, in the clinic, absolutely no favors, no photographs, because then they take you for granted.
Exactly.
And we have to maintain ethics. We can't spill out names to other people. We, also, this is something that they like about me because I do not, my lips are sealed. There are days, there was this very nice, funny incident where the husband and wife were both coming to me and both didn't know they shared the dermatologist.
Oh, that's funny.
And it happened for almost 2 years. Till one day they said, my dermat is better than yours. And it happened to be the same dermat. And they said, my God, this is ethics. So I think that really helps.
True, very true. Because I think you have to maintain confidentiality.
You have to maintain, yes.
And that's how I do too. We don't take photographs and staff are not allowed. And no juniors are allowed to come inside when I'm doing the procedure.
Yes.
Because they don't like
absolutely
to be seen
they
that
don't
they
like
are
to be
undergoing
seen.
the treatment. And they have the special entrance to come in and go out. I think that's very important. And one thing I found is you can be friendly with them, but you should not make friends with them.
Correct. That's the key. You cannot be friends with them. And that's a wonderful thing you've said. You can be friendly, but don't make them your friends.
Exactly.
That's where you begin to lose
and
it all.
Nowhere in our Instagram or Facebook, we do not take pictures with them. We do not post pictures.
Yeah.
Because I see the younger generation take so much pride in, even if they've come for a consult, leave alone a procedure, they immediately take pictures and post it on the Instagram. I think that's not ethical.
It's not
we
ethical.
are professionals.
Yes.
They forget that we are professionals. I think this is a message we would like to, otherwise they will lose confidence in all the doctors they meet.
Absolutely, yeah.
I think we belong to the older generation where we maintain ethics,
Yeah.
we maintain confidentiality, and yet we are able to achieve what we want. I think that's a great message you've conveyed, and I'm glad that both of us are in the same level of thinking.
Yeah, I've learned it from you, Maya. Don't forget, you
my
are
God.
my mentor.
Jaishree, and now I'm learning it back from you.
That's very sweet of
What
you.
I sow, I reap.
Yeah, it's always such a pleasure, to be with you, to meet you, to learn from you, and I feel blessed that I have you in my life. Thank you so much,
Oh,
Maya.
how sweet of you, Jaishree. I think I have no words to express my thankfulness, and I really hope and make you and see you on the top of the world.
Thank you
I know
so
you
much.
are already on
No,
the top
I have
of the
miles
world.
to go before I sleep, but with support from people like you and all the encouragement and the help, because whenever I'm in trouble, I call. So thank you so much.
Thank you, Jaishree. It's been lovely talking to you.
Same here.
And all the best.
Thank you.